Hey James,
Yes.
if somebody says they've got hip pain, where do they usually point?
Oh, here, everywhere.
It's a lot of reasons people have hip pain, but stay tuned, we'll tell you the number one reason and what to do about it. Welcome to the 50 Shades of Pain show, where we empower our community by demystifying pain, both physical and emotional, to give you the tools that you need for optimal health. Hi, I'm Dr. Donish, the medical director of Wellward here in Lexington, Kentucky. I'm here with my co-host, Dr. James Escaloni. And today, James, we're talking about hips.
Yes, sir.
Hips are so confusing to most people who experience it because literally people will come in and tell me they've got hip pain, and when I ask them to point where it is, they can point to half a dozen different locations, from this outer part, which is often termed bursitis, to this groin area, which is typically thought of as arthritis, all the way to back here, where your pelvis joint sits on top of your spine sits on top of your pelvis, that we call the sacroiliac joint. And any one of those could be problematic, causing a domino effect that affects all of those other regions.
Let alone anything coming from your lower back that confuses the situation.
That's true, yeah. Because sacroiliac and back pain, low back, lumbar pain go hand in hand.
Mm-hmm. So this is a fun thing because we've got to tease out for you what comes from where. And that's part of our fun because we're pain detectives here.
That's right. And that pain mapping process is figuring out which is the first domino that fell, causing the others to also collapse.
So with this whole process with hips, what do you think is the number one problem that people have with hip pain that comes into our office?
The most common thing that we see is when people point out here, or they come in with a diagnosis of Trochanteric Bursitis. Exactly. It's a bursitis because it's often termed bursa or bursitis, but it's typically from something else. So what is a bursa to begin with?
So a bursa is a fluid-filled sac that allows a lubrication between two areas that are moving back and forth, so there's less shear on stuff.
And if it's inflated or inflamed, it's not because the bursa is the problem, it's because something else has lost its stability that's creating more friction in an area, and the bursa is just symptom of that other problem. Mm-hmm. The most common reason is what?
It's actually a tendon issue. Now, how many times have you scanned a hip where you've had the diagnosis where it's trochanteric bursitis and there's a perfectly normal bursa?
Just very common, very, very common. I won't say all the time, but quite close to all the time.
And so how many times do you scan that hip and in the absence of an inflamed bursa, you see an irritated tendon?
Almost all the time. I won't say all the time, but almost all the time. Yeah, so the tendon is typically the precursor to the bursa being irritated. Why that's relevant is because as we age, this is going to happen to all of us. The collagen in our bodies starts to degrade. That's why we develop wrinkles, is because our skin loses collagen. Well, the same thing is happening on the inside in our joints. What we term as face wrinkles, I call joint wrinkles on the inside. And as that tendon loses its stability, its elasticity starts to lose. And so if you go to move and your body is not warmed up or prepared or lubricated for that, then it can create small cracks in that tendon, which over time develops into a weaker and weaker tendon, eventually causing it to be damaged enough to the point where then everything else starts to get friction and irritated and cause that typical bursitis diagnosis. Mm-hmm.
So when people have this bursitis diagnosis, but it's actually a tendon tear more often than not, what symptoms do they usually have?
Typically, it'll ache out here. You can have a sharp stabbing pain on the outside part of your hip. If it goes on for long enough, it's going to distort the way your hip moves, and it's going to put pressure on other parts of your hip. The hip is a ball and socket joint, meaning there's a ball for your leg that fits inside this socket for your pelvis, and it's held in place by ligaments and joint capsule, but it's mobilized and held in place at the same time by muscles and tendons. And if you have a muscle or tendon that's starting to break down, it's going to cause stress on the rest of that whole joint structure, and over time that increased friction is what causes the erosion, what we think of as bone-on-bone arthritis. But if we stage back several years, we can see the evolution of that hip pain start off with some kind of a tendon or ligament or stabilizing structure issue that goes unchecked long enough, and it causes that erosive problem called arthritis.
And that's actually pretty appropriate, because the people who are coming in for our hip pain, they're usually coming in saying, I've had this for years and I finally decided to do something about it. And really, if they had just come in years ago, then this would be a heck of a lot easier to take care of these people.
In pain, the adage, an ounce of prevention is worth a pound of cure, is truly applicable. I encourage everyone who has had this minor achy issue or minor problem to get it checked out sooner than later, because that could be the first step down a long pathway towards an erosive, degenerative, arthritic joint.
So if we've had people come in and they have the pain, we diagnose it, and the most common thing is this tear of the gluteus medius tendon or the gluteus minimus. What do we do about it?
Or IT band issues or tensor fasciae latae. These are all terms for structures that stabilize that outer part of the hip. And the first step in our HEAL methodology, which starts with hearing the messages your body conveys with pain, is to map it out and figure out where the origin of that pain is coming from. Once we figure out the muscle, the tendon, the ligament, whatever structure has lost its form, once we identify that, then it's a matter of either doing exercises that can help strengthen that, types of injections that insurance will cover, which will stimulate a repair response, or do a very aggressive repair response injection, things like platelet-rich plasma, bone marrow aspirate, or prolotherapy. These are different types of injections that have a much more enhanced approach towards stimulating a repair response from your body, essentially using your body to mold or craft greater stability to where it needs it the most.
And I think that a big thing that you said was very key for people, no matter what's going on, the exercise to help build that up, that's going to be a big component of either early stage, or even if they have orthobiologics, they're going to need to teach their body to be strong and resilient, especially after we've done some alleviation of the symptoms, which is the A part of the HEAL.
Yeah, HEAL, hearing the message your body conveys with pain, envisioning what the goals or objectives are, alleviating the symptoms, lessening the pain, and finally leveraging repair processes to actually get your body healthy, strong, and fit back to baseline. When I started my training, somebody came into me with trochanteric bursitis. The intention was, well, let's just calm the pain down, but we know it's just going to be a revolving door. It took me quite a long time to figure out there are better ways of doing it outside of the traditional approach, where we don't have to just give people this terminal diagnosis that you're going to have to live with, and the best we can do is just kind of temp it down periodically. Now we actually have tools that solve the issue without surgery, without invasive procedures that people have weeks of recovery. We're able to do it within a few days of recovery and a few weeks of rehabilitation.
And if you are stuck in that cycle with wherever you are, and you're just getting a high-dose corticosteroid into your hip over and over again, well, that's going to be going down a pathway of destructive changes, because it's not good.
I'm sorry to interrupt you, but it definitely accelerates that damage process. It's short-term gain for long-term loss, and I just don't agree with that mentality anymore.
So if you guys are at home and you're kind of wondering a little bit more about this, check out our Facebook page. We're going to do more information about this. You can listen to podcasts where we talk about the subject on Spotify, iHeartRadio, iTunes, all those types of resources to help you out. And heck, if you're in the Lexington area and you've got some of these problems, you can call us up. What is that number again?
859-275-HURT. HURT.
Oh, lovely.
Fancy.
Yeah, hard to forget. All right.
That's right. And feel free to leave us comments, because it does help us craft the future shows, and tell your friends to tune in to all these websites, outreaches that we have.
So, from here at Wellward Medical, I'm Dr. Escaloni.
And I'm Dr. Donish. We'll see you soon.